Sustainable Development Data. I'll be your moderator for the first half of this expert dialogue. Just a little bit of background: these expert dialogues are a follow-up to the webinar we had last year in December, showcasing experiences of countries on CRVS systems and in the COVID times in Africa. So these dialogues are really to dig deeper into the case studies and the issues in the country, an opportunity to ask questions, an opportunity to share your own country experiences and your learnings. So we've divided this this workshop or this expert dialogue into two. We have part one, where we'll do some intro remarks. We'll have a recap from the team in Ghana. And then we'll answer a few questions that we've received so far from participants. And then we'll move into part two, where my colleague Zoran will take over. He'll moderate a session also bringing in Ghana and other participants on the call to have a conversation about continuity plans and strengthening CRVS in the continent. Just to let you know, this is an expert dialogue. We don't have any PowerPoint presentations. We won't have any. We won't make any presentations. It's an opportunity to hear from all of us. So for part two, we'll welcome people to speak up if they want to ask a question or if they want to give a comment. The process is requesting to speak. So on the bottom right of your Kudo window, you'll find a request to speak. Once you click on that, then we'll know that you want to speak and we'll give you an opportunity. I'll repeat the same instructions at certain intervals during this event. Also, for the benefit of our French-speaking colleagues, we have French translators. If you want to listen to this event in French, you go to your bottom right window, bottom right of your screen, and you'll find a white strip there which is written flow. If you click on it, you can select your preferred language. At the end of this expert dialogue, we'll be sending a short poll, a short survey, just to get your feedback for us to improve subsequent expert dialogues. And when I mean subsequent, we have our last expert dialogue in this series tomorrow, where we'll be focusing on Namibia. Well, without further ado, I want to invite William from the UNECA to provide some opening remarks. Over to you, William.
Thank you, Karen. Thank you, everybody, for attending this webinar, which is the second in a series of the expert dialogues, which our partners and ECA, we are running. I think it's a very good start to the year to actually start looking at CRVS. As I said during the first dialogue, and I would want to remind people that this is our year of the 6th Conference of Ministers. So as we prepare for the 6th Conference of Ministers, we actually have to show what are the innovative strategies which we have actually been employing in strengthening our CRVS systems. And in the context of COVID, how are we planning to rebuild the systems which have actually been shaken by this pandemic? And one of the strategies really is what our colleagues in Ghana will be presenting, which is the business continuity plans of civil registration systems when we are faced with emergencies. So, although we are using the COVID-19 as, an example, emergencies are there with us. We were in the Ebola crisis, and that Africa is prone to wars, is prone to natural disasters and so forth. So considering what can be done to continue services in these emergencies is actually what we are looking at. So the example which has been documented from Ghana will actually help us to make sure we actually have these plans in place. Actually, we don't have to wait until the emergence happens that we start thinking about a business continuity plan. The business continuity plan should actually be part of the system. It should be somewhere, and it is activated as the emergence occurs. For example, if there's a natural disaster or there's an outbreak of Ebola or there's an outbreak of cholera or whatever, that plan should be available and it needs to be activated as the emergency comes into or occurs. So what might need to happen is actually just that the continuity plan can be adjusted depending on the emergence. For example, if it is a natural disaster like an earthquake or a flood or something like that, it would differ in response from an emergency activated by, let's say, a pandemic or an epidemic. So a standard sort of business continuity plan should actually be existing in the country, and it can be modified as the nature of the epidemic or the issue is known. So what needs to be, or how does it need to look like? So the business continuity plan, the first characteristic is it has to be dynamic. It is not as stationary as our normal way of doing work, that we, wait for informants to come and inform about the vital events. Then we do the process of registration and certification and so forth. So for business continuity plans, they have to be dynamic in the sense that they actually have to take the circumstances happening into account. Then secondly, they have to be reviewed periodically, because when an emergency occurs, there's the peak, or there's the start of the emergency, there's the peak, then it starts fading off or even dying off. So the business continuity plan should also follow that pattern of how the emergency is actually moving. And if we take the example of the COVID, we expected that COVID possibly, I remember, in March last year, when we postponed a number of activities, I said, by August, we will be able to go back and do whatever. I remember, we were actually working on the United Nations Legal Identity Agenda, and we were saying we'll be going back to the assessment missions by August. But up to now, we haven't even gone back. So these have to be dynamic and to be reviewed periodically. Then the second aspect, they should determine the methods of working. So if there needs to be partial opening of the offices, total closure, and if people need to be working from home, or who will actually be working remotely and so forth. So the more methods of working needs to be actually specified. Then the business continuity plans also entail the revision of protocols. For example, protocols which determine, let's say, a birth or a death has to be registered within the first 30 days. So in any emergency, that might not be possible, or even notification itself might not be possible. So all these protocols, regulations, and rules need to be revised so that they actually take into account the realities of the emergency. So if the emergency can't allow, the informants to go to the registration centers, then there needs to be revisions on that. Also issues like revising the fees, which have to be, or the penalties, if people cannot adhere to the time allocated to, or which they need to notify an event and so forth. So these three characteristics really needs to determine our business continuity plans. And with those words, we can actually see or call upon Ghana to show us how they applied all these principles of dynamism, the determining their method of working, the revision of the protocols, and so forth. So with those few words, thank you so much. Let's hear from Ghana. Over to you.
Thanks. Thanks so much, William. As you've mentioned, and I think you've raised some really important issues around how do you continue the business of the CRVS systems even during a pandemic. I want to invite now colleagues from Ghana. We want to just do a very short recap of the Ghana technical paper for the benefit of colleagues who have joined today who were not there with us in December. So I'll give you about 5 or so minutes to do a short recap, and then we'll respond to a few questions. Over to you, Ghana.
Hey, hello. Hello, can you hear us?
Yes, very clearly.
Yes, so just a recap of what we did during the lockdowns and when COVID-19 took over the whole world. In our last discussion, we highlighted on the activities we put in place to ensure that civil registration don't halt. We are aware that somewhere in March, the country was locked down, but civil registration could not wait. So what we did was that special permissions were given to critical staff to be at post, and especially at the headquarters level. In Ghana, 2 regions were locked down, the Greater Accra region and the Ashanti region. In these regions, critical staff were given special permissions to move about. At locations where we were unable to open up the registration centers for registration, what we did was we pasted contact numbers for registration staff who are contacted during an emergency. In the event of a death registration, they are contacted and then they come in to register and then they leave the offices. So those offices were not open, but some areas, especially in the major hospitals, were fully functioning with special permissions to staff to move about. We were also trying to speed up our technological platform so that we can work online. That is something that is ongoing. We are not fully integrated yet. And then we are also almost deploying our online portal where applicants could now communicate with us comfortably at the comfort of their homes to ensure that we don't break registration. So as a recap, these are some of the practices the measures we put in place to ensure that registration doesn't halt. Over to you.
Let me also quickly add that we actually considered that for us at the Births and Deaths Registry, whether it was an emergency or not, vital events were critical for attention, especially even if COVID was coming about with deaths. there was a need for us to ensure that those deaths were properly captured and documented in order to help decision making. So we did not shut down completely. We ensured that work still went on even during the lockdown. And like has been said, all staff were granted permits so that even in the lockdown, they could move to offices and still register. In very key hospitals, the government hospitals in Accra, Ashanti region, Kumasi, and all the key hospitals, we made sure that were not shut down and staff were at post throughout the period. In areas where we thought there was difficulty, we ensured also that we got mobile or itinerant registration officers to be moving from community to community to also pick information. But then we did that after we had properly equipped them. So we provided PPEs for all staff so that to facilitate their protection and their movement, we kept work ongoing. At the same time, we wanted to take advantage of the developing scenarios to also ensure that legislatively, we would ensure that protocols are reviewed, laws are revised to make sure that we got in tune with the current trends. I'm glad to say that Ghana has been able to review its birth and death registration laws. A few new protocols have been integrated and introduced just to facilitate capture of data at the community level. And to this end, we are devolving registration services to the district, the zonal, and the urban council level with very deep involvement of Ghana's district assemblies so that registration will be done and become operationally functional right from the district level. We have done all this and taken into account the fact that there are certain barriers to registration services. For instance, penalties and fees. We have ensured that the new law has actually abolished penalties and fees for all registration of births that are done within a space of 1 year. And for deaths, all penalties are also abolished for deaths that are captured within a space of 30 days after occurrence. We think all these will go a long way to enhance data capture and motivate people to report vital events for rapid registration.
Over to you.
Thank you. Thank you so much, Mr. Kingsley and Mr. Bochwe, for that recap, but also sharing of the experiences. Couple of questions. I think I'll do about 4 rounds, ask you some specific questions. I know we received about 13 questions. I won't get into all that because some will go into part 2. But for the benefit of colleagues who are just joining us now, we have 2 parts in this expert dialogue. We just getting to the end of part 1, where we've heard from William and we've heard from the team from Ghana. We'll respond to a few questions and then we'll go into part 2, which is a moderated session run by my colleague Zoran. It will be an opportunity to receive, to hear from you if you have questions, if you have comments. The process is you'll request to speak. There's a blue button to the bottom right of your window. Once you request to speak, we'll allow you to speak, and Zoran will give you an opportunity to ask your question or to comment. Again, if you are joining us just now for translation, if you want to hear this dialogue in French, to the bottom right, to the bottom left, sorry, there's a white button. If you language. Just also a request to colleagues from Ghana, in your response, kindly speak slowly, just for the benefit of the translation. So my first question is really just touching on some of your experiences in business continuity during these COVID times. Tell us what are some of the most difficult barriers that you faced in this process, and what are some of the strategies that you have taken to overcome these barriers? Over to you, Ghana.
Yeah, thank you so much. In the process, like I said, the challenge has been how to get people to enter the front line to pick data in real time. Movement was a bit restricted. access to registration services were also restricted to a certain level. But then what we had to do, like we said, was to ensure that our workers or birth and death registration staff were given special permits and considered as frontline workers, so that in all the hospitals and even at the community level, we ensure that channels were open so that people who needed registration services could use those channels to access service. Over to you.
Thank you. Thank you so much for that response. The second question, I just want to touch on some of the tactics or some of your ways that you've managed to, strengthen advocacy, building that political commitment for CRVS improvement plans, and, what advice would you give countries so that they can effectively plan for CRVS during these COVID times?
Thank you. We realize that the births and death registry on its own didn't have a strong voice. Therefore, the strategy was to collaborate with other agencies. And the birth and death registry in Ghana is a department that works under the Ministry of Local Government and Rural Development. Therefore, we're fortunate enough to have very big presence of our ministry, led by the minister herself, Ajia Alima Mahama, who came on board, led the legislative reform processes, and also led most of the advocacy campaigns. Fortunately, our minister is a cabinet minister. Therefore, once issues concerning civil registration came to the table, it got to the attention of cabinet, and immediate attention was given to registration issues. That is how we were even able to get our law quickly passed. We also, in Ghana, were in the process of doing a national identification program. And as a requirement to get the national identity card, you needed to produce a birth certificate. Therefore, we leveraged on the mass registration exercises that were going across the country to ensure that people were made to understand the processes involved in getting a birth certificate prior to registration of any event. At the same time, we were able to hold stakeholders consultations with identifiable bodies in Ghana, especially the traditional rulers. We managed to meet with the National House of Chiefs, and we discussed issues of vital registration with them, and they bought into helping to do advocacy at the community level, at the traditional level, on behalf of the registry. We got the Ghana Health Service as a major partner, who are also in touch with parents and children right at the early ages of life. So we worked closely with the Ghana Health Service, and at the immunization clinics, we were also able to push the registration agenda and explain issues for parents to buy into early registration of their children. One big thing that helped us was the collaboration of between Ghana Health Service for reporting of deaths and births. We introduced a notification system between the two agencies, the Births and Deaths Registry and the health services. So as soon as any event of a birth or death occurred in the health facility, notice was served to the nearest birth and death registration office. And then the registry will follow up and pick the event. So it has been a question of collaboration. And we got support from the Central Statistics Office, the Ghana Statistical Service, to also help us reach out with information on births and death registration, as well as several other agencies who we thought had a stake in the use of the data that we generated. We have also used faith-based organizations, the religious organizations, churches, the mosques, and the religious bodies to also help disseminate information about the advantages of early registration of births and early registration of deaths. The last agency that we used in advocacy was the Ghana's Social Security and National Insurance Trust Agency, who would demand death certificates before payment of welfare benefits to any beneficiary. So all these agencies came together to pool resources. We shared ideas, and then they helped us to do some public outreach and community events. We also have been able in Ghana to engage the services of the media. And in 2020, we used radio stations and TV stations a lot. They gave us airtime. Some collaborated with us to also organize mass registration programs for residents around the country. So the media has been very helpful. Let me quickly add that Ghana is also a country that has been able to institute a birth and death registration day celebration. So from the month of September through to the end of December, we have used the period to highlight or increase advocacy programs using various strategies to reach out with messages on birth and death registration. And the strategy has been to target areas where registration services are very weak. So every year we identify one poorly deprived area in registration centers, and then we hold debates with them, with the chiefs, the people, and we conduct registration exercises free of charge. What has helped us is the fact that government has also been very magnanimous, and for the first time, it has now found expression in our law that registration services are free and all costs are borne by central government. So these are some of the issues that have helped us to reach out to the public, to create awareness, and to create demand for registration documents, which is actually pushing registration coverage up places for us. Over to you.
Thank you. Thank you so much. That was a really elaborate advocacy agenda or advocacy strategy. And I think I really liked the importance of having champions. So with the minister, and also because registration was a priority because of the identification system and the drive. So really it worked well. I have two more questions for you. One is a bit technical. This question came from about three participants. Ghana is looking to deploy mobile equipment for registration of e-birth notification in order to increase coverage. But how will you take into consideration the fact that there could be network issues, and also how have you actually utilized mobile technology during this pandemic? Over to you.
Thank you so much. We are fully much aware of the difficulties that will come with network challenges. The reason we are doing a mix of registration services. So we received support from agencies like UNICEF and the World Bank to ensure that in areas where we have very good internet connectivity, we go all out to deploy the online services. In areas where there's weak internet connectivity, we still are pushing the offline services using community registration exercises, mobile registration exercises, and pushing the paper-based registration regime to the maximum. So it is a mix of both. Until we are able to ensure that there is good internet connectivity all around the country, we'll continue to still deploy our services looking at the terrain. So where there is good internet connectivity, we are able to do the online registration using tablets and phones. Where we don't have connectivity, we still use the paper-based thing. Under the public sector reform for results project, which is funded by the World Bank through the Office of the Senior Minister of Ghana, we also are deploying what we call, we have captured it, mobile registration services. That will not have to do with mobile technology, but it will have to do with the physical movement of registration operatives to remote areas in the country. On this score, the World Bank has supported the country to procure 10 mobile registration vans and 120 motorbicycles that are deployed to areas where registration services are poor, where internet connectivity remains challenging, so that we could complement what we're doing technologically with physical presence at the community level to pick information on births and deaths. So this is how we are actually balancing the act. So we are leveraging on the strengths of each area in the country. Areas with good technological presence will leverage on technology. Areas where we don't have technology will still push paper-based and physical registration activity. Over to you.
Thank you. Thank you so much. My last question before I pass it to Zoran, and this has come up across the three expert dialogues, and I know William has talked about this over time, and this is on death registration. I'm just keen to hear some of your advice or some of your experiences to other countries, and maybe some lessons there on what could be done to improve death registration.
Death registration. Yes. Let me draw from the example of Ghana. In Ghana, we have a large rural interface. And in most of our rural areas, registration services are not too developed. So what we have done to try and improve death registration there is to use community-level operatives to notify registration operatives about occurrence of deaths. We collaborated with the Ghana Health Service to pilot a verbal autopsy and mortality statistics generation scheme, so that even when deaths occurred and they're not medically certified, we could still get notice from the community. We went into the communities and trained people on how to register deaths. We used the chiefs and the local leaders and religious leaders, created awareness, and then they will now give us volunteers who are resident within the community to pick information on all deaths as they occur, and then we will follow up and register them. At the same time, we had opportunity to also introduce what we call community relation registers, and we selected some communities which we thought were weak in death registration, and then piloted the program in there. So we are getting a lot of feedback from the community level operatives. Since they live in the communities, as soon as an event occurs, they are able to pick the information and then send it to our registration centers for the necessary things to be done. Fortunately for us, we have also noticed that in most of our rural communities, burial grounds were not controlled. So people could bury even without registration. That is by not getting permits. On this score, our new law is now mandating all district assemblies to register all burial grounds, all funeral homes, all morgues. So before anybody is released for burial, the assembly will ensure that the death registration process has been fulfilled, and then burial permits are obtained before burial is allowed. So we are working closely with these assemblies to ensure that all burial grounds will have appointed sextons who would inspect burial permits before burial is allowed. And you could only get a burial permit after the death has been properly registered. Over to you.
Thank you so much, Ghana. I think your experiences are really interesting and really useful, and the sentiments we're getting from the messages is that there's some really good stuff to learn from Ghana. Well, I don't want to run the show and be selfish. I want to pass it over to Zoran so that he can moderate the next session. As I mentioned, this session will be allowing people to speak and ask their questions or give comments, and the process is bottom right, request to speak, and we'll give you a chance. Zoran, over to you.
Thank you, Karen, very much. It's my pleasure to be part of this webinar and for this expert dialogue on such a pertinent and timely theme, and that is business continuity plan in the times of the crisis. Unfortunately, we are all faced with this terrible disease and the situation that is causing across the globe, including across South Africa, causing a range of issues for national civil registration authorities. Obviously, the question is, could we all be prepared better? Could we learn from everything that has happened over the past 1 year to be prepared for future possibilities that will yet again interrupt civil registration processes in any of the country across the continent? I have a small request right at the beginning, because this is going to be expert dialogue, and it's really not the idea to continue interview and the dialogue between myself as a moderator and distinguished colleagues from Ghana, that you switch on your camera if that is currently available, just to have a sort of a virtual presence around virtual roundtable, because we would really like to see you, and we would also like to hear your expert feedback on this topic. And yet again, I reiterate business continuity plans, to what extent they are important. If you're coming as a representative of a national authority, what are your national experiences in putting in operation these contingency plan or business continuity plan? What challenges you've been facing in the process? Obviously, we can learn a lot, and we will have a chance to discuss a little bit further with our distinguished colleagues from Ghana about their own experience. But we would also like to hear other representatives from other countries, and also we benefit from the fact of having quite a few recognized international experts on this topic, who I would also kindly invite to reflect their position on this particular topic. Equally, this session will be a chance to probe further into the developments in Ghana, especially with regards to business continuity plan. So we would equally accept further questions on the system in Ghana, and there are two ways which this could be done. One, the simpler way is to use the chat box to ask the questions, and I will have a chance to read them and then convey these questions to distinguished colleagues from Ghana. At the same time, it would be way much better, and we would appreciate if we could hear the question live with some pretext, with some background of the expert thinking, what prompts this question and why the question is important. To that effect, as Karen was mentioning earlier, there is a tool, there is a blue button further down on the right. It says request to speak, I believe. And then your window will screen, and then I will have to pass on the floor for you to ask the question or to provide comment. When the question is asked, then you press the release mic, and then you are no longer for the attention for the discussion. So this is about technology a little bit. So please, the floor is open. I kindly invite anyone to press the blue button for a comment, for a question. until we get to that stage, I would like to ask some further questions of more general nature to our distinguished colleagues from, and that is about the very business continuity plan. What we could learn, and I could see from comments from the chat, is that colleagues that are attending this webinar are pretty much impressed about the range of novel approaches to registration and innovative approaches that previously were not implemented in Ghana, were now easily implemented as a result of the business continuity plan. My question would be, to what extent this whole crisis has accelerated some of your earlier plans, and how many new things and new approaches you were being able to push forward, to implement, to introduce in the system that otherwise, according to existing non-crisis related regulation, otherwise would have been impossible. Over to you.
Thank you. Before COVID, the issue of death registration did not receive much attention in Ghana because we all took things for granted, and the public awareness about the importance of sole registration itself was very low. Let me say that around that time, we were registering only about 17% of all deaths that occur in this country. But now people are becoming aware. The issue of COVID is now creating a platform for all of us to realize that if we do not keep track of the numbers, if we're not able to isolate and identify and isolate the causes of deaths, then it means that we will not be able to make good decisions. Therefore, looking at this from the health angle, looking at it from the social angle, looking at it from the data angle, we all realize that we need data so that we'll be able to interpret data properly, to be able to make correct decisions that will help us fight the pandemic. Also, it has been possible for us to now be able to attract some support, our funding and resources, because of the importance everybody is now putting on sole registration, and especially mortality registration, so that causes of death could be properly organized and analyzed. So we are seeing these as advantages. Before then, people didn't put any premium on death registration at all in this part of the world. But now everybody is aware that deaths need to be properly accounted for and tracked. And this is also opening the doors for us to receive a lot more support and attention from government and from stakeholder institutions.
Thank you very much for that feedback. And indeed, it is very important, and it is quite encouraging that we are hearing, although the pretext for raised interest for that registration is rather severe and quite terrible. Nevertheless, there seem to be heightened interest amongst the authorities for better information on cause of death and the mortality in the country, and the recognition that civil registration vital statistics systems are credible source of that sort of information. There was one quick question, and I would like to ask for a quick follow-up question. To what extent of all the notifications of death there was the opportunity to actually properly assess the cause of death, and to what extent a verbal autopsy was being used in the process?
Yeah, you can pick that. Yeah, hello. Yeah, so what we did was, as mentioned earlier, we tried to test notification within communities, and we've tested this in 3 regions. We tested it in the Upper East region in 1 district, and then we did for 12 districts in the former region called the Volta region, which is divided into two regions now, Malta and OT regions. And the experience in that is that we are seeing improvement in death registration coverages in these districts that we have tested the notification. The idea is for us to do it electronically because sometimes it takes a while for the notification to get to the nearest registration office for burial permits and certification to be issued. So, I mean, this is the experience so far.
Yeah, let me add that for us, verbal autopsy is novel, it's new. Traditionally, we would have loved to get a medical certificate of cause of death or a coroner's inquest report before a death is registered. That way, we are sure we could put our hands on the actual cause of death. Now, for verbal autopsy, we would register the event usually after the body has been buried, and you get aggregate information or data about the causes of deaths. So it is new, but the advantage here is that because of the awareness that we need data on mortality, people report the deaths all right. So we're able to get the numbers, at least, if we're not getting the causes of deaths in real time. We hope that when the system is perfected, we'll be able to get numbers matching the probable causes of deaths, and then strike that against the actual causes of deaths. And then you can together make decisions and look at the way forward on how to perfect and improve the system. So number-wise, we are seeing an increase in reported cases. Now we want to now fill the quality and make sure that we also get the actual causes of deaths as will be given by the VA or the MCCD. Over to you.
Thank you. Thank you very much. That is indeed very useful. As I said at the very beginning, the idea behind this second part of our discussions today is to have a broader discussion with other experts around this virtual table today. And I would love to hear opinion, positions, feedback on the national experiences from other experts as well. I hope I can count on some feedback from distinguished colleague Innocent Bongandwa. If you are available to maybe share a few of your observations, I would kindly ask you to press request to speak, and when I see your name pop up on the screen, I will be passing on the floor. I would equally appreciate if our colleague Khadija Tou would be joining us for some general impressions from her own side. That would be also very much useful. But until I hear signs for requests to speak, I will continue with the questions and our dialogue on these very, very important developments in Ghana. The question would be, my question, it's more of a follow-up question, and that is, you did mention that obviously there is a high interest to see what are the figures in terms of death registration pre-COVID and in the midst of this horrible COVID crisis. I heard loud and clear that obviously some information is coming through, that you have raw data, that you're working on the quality of this data before that data can be officially released and shared. But perhaps you might share some general feedback from your end. Do you see trends? Do you see observations that CRVS data that you have collected so far might be pointing out, not necessarily as a fact, but more as a trend that you are observing for the time being? Over to you.
Can you come again? I didn't get the question clearly.
Yes, the question is, if we observe death registration data from previous years and death registration this year, do you observe any interesting trends when you compare these two datas? Does that data tell us anything specifically at this point of time?
Okay. It is early days yet. We are now even trying to do analysis of the last year's data and the current data. But generally, you could have the feel that we are actually getting a little bit more response for debt registration than we used to a few years back. And like I said, people are now becoming increasingly aware that you need to register a death. And because of the crisis situation, people are also now buying into any education that you put out there. But this is necessary. We need to do this. So in good time, we will have good data to share with countries. But we are noticing from the top of my head that there's a good response to debt registration now.
Okay, thank you very much. I think we are all anxious to hear about the trends in terms of mortality data, excess mortality, some initial projections, but as you pointed out, it's way early right now, and that before we get to that point, some quality assurance need to be done. So I'm happy that we are expanding our discussions. It's not going to be myself and colleagues from Ghana only. I'm happy to call upon Ms. Tiam for feedback.
Allô? Allô,
Yes.
oui.
Hello.
Je vais m'exprimer en français. Bonjour à tous.
Hello, everyone. This is Ms. Tiam. I'm going to speak in French, and I would like to congratulate Ghana for doing well and making progress for continuity business plan. But I would like to talk about something quite important for us, to offer services of registration. In our country, we see that the coverage is quite low. We have zones where in villages that are very far away from any data center. And I would like Ghana to tell us about the statistics they are using to make sure that our services are getting closer to our population and our community. Do you have specific activities? What do you do in case in rural areas, very far away from any centers and cities? What strategies do you use to register birth and death? I see that several strategies are used depending the network. And is there a distortion with the total coverage of the country? If you have diverse strategies for different zones, are you going to have an issue at the level of the country? You have different ways of looking at the situation. If you're working online when you have a network, and where you're looking at working offline when there is no internet network available. So how do you converge those data? Thank you very much for Ghana. And here we are in Senegal, and we do appreciate working with you.
Wonderful. Thank you very much for that question. To all the audience, just a quick reminder: if there is a need for intervention in French, obviously you are free to speak. For a non-French speaker, further on the left, there is a dialog box where you can switch between English and French, and then for me it says floor. You can move to English, and then you will be hearing English translation. If just in case somebody didn't manage to switch to translation, and the translation is required, I will repeat the question, and that is that it would be great to hear once again, although we touched upon that issue in the introduction, about strategies for reaching remote areas. Obviously, there is a great deal of interest in that particular effort. And I know from my own research and previous discussions with our colleagues in Ghana that there is a quite elaborate system of mobile teams, visits to specific areas, announcements of these visits, and then speaking with dignitaries of local communities to organize for the registration events. The question is really how do we know in which areas we have children that we need to register, which areas are most important, which areas are priority, and then maybe in a greater level of detail, what is the strategy step by step to make sure that mobile team is deployed and all the events are captured within specific local community within remote area.
Yeah, thank you so much. What we have done in Ghana is that we have declared every area a priority area, but we are putting more emphasis on the remote and inaccessible communities, especially in the rural countryside. So we are in touch with community leaders in the various communities. We are in touch with health caregivers, health workers. And like I said, because of expanded immunization programs that are going on around the country, we are able to take the numbers from the health service. So we get indication where new children are born, when they attend the immunization clinics. We have that information, and we have attached registration officers, as well as the mobile registration officers, to the immunization teams. So as they go to immunize the children and deliver healthcare services, we also deliver birth registration services, especially to the children. And we have community-based volunteers who also, on a regular basis, normally on a monthly basis, they report on new events that have occurred within their catchment areas that are zoned out for them, and then the district registration officer follows up to capture the events and certify them on the spot. And like I said, we have actually waived fees for all registrations done for a whole period of 1 year. So from the time a child is born until the child's first birthday, once the event is registered, there is no penalty, there is no fee. And when the event is registered, instantly a birth certificate is issued to the parent. And we think these are things that should motivate the population to respond to registration services. Now we are trying to get the Ghana Education Service as a partner to also demand birth certificates as part of school enrollment requirements. And since in Ghana, basic education starts at age 4, and there is free compulsory basic education, we are sure that as children enter school before age 5, we can also get them to register. Our new law has also pointed out people who we are designating as notifiers. And these people are healthcare professionals, traditional birth attendants, and heads of schools who are in touch with children who are not registered. They are enjoined by the law to now notify the district assembly and the birth and death registry so that follow-up visits can be made to pick information on these people. So for us, every area in this country is priority, but more attention, more resources are deployed to the remote areas and the rural communities. Thank you.
Thank you very much. I think that very much answers the part of the question. I think we can touch upon a second aspect of our question from a colleague from Senegal, and that is the use of digital technology. That is obviously an important theme, but I would like to touch upon something that you just mentioned briefly, and yet I think it's extremely important and something that we are seeing across other countries in Africa. And you mentioned that that critical moment that parents are issued a birth certificate right away. How is that possible? If you could comment, what sort of arrangements you have to ensure so that this is a one-stop visit, that birth could be registered possibly in one go, and how does that process looks like? If I misunderstood, if it takes longer to register, maybe we can just try to understand how you increase the performance of the registration process so that birth certificate can be issued in a relatively compressed period of time.
Yeah, thank you. What we have done in Ghana is that we have district registrars in all districts in this country who would pick pre-printed certificates in a booklet form. So when they move out to do registration in any community, they have the certificates with them in booklet form. Once the information is captured on the questionnaire, the birth registration questionnaire, which will take about some 15 minutes to finish. At that point, if everything goes through, the registrar is empowered to sign a birth certificate on behalf of the registrar for births and dates. So all our district registrars and community registrars have the power to sign certificates and hand over to the parents. And then they now transfer the information they collect from whatever level, the community or the district, to the central registry database. So that's the arrangement we have put in place. So certificates are not signed centrally, they are signed at the community level, and the district registrar, the community registrar, has the power to sign a certificate and give to the parent on behalf of the registrar of the certificates.
Thank you. Thank you very much. This is a really important point, and I really appreciate that you shared this experience with us, because yet again, we are seeing this approach unfolding in other countries in Africa. Namely, 2 days ago, we had a similar webinar with our colleagues from Tanzania, where this system has been enrolled over the past couple of years. And it is yet again one-step process. What does that mean? It means that parents can benefit from registering their child as part of one visit. As they come, they inform about the event, and if all conditions are in place, they can as well receive birth registration certificate. I think this is a very important learning about this trend for all of us around this table. Next set of questions that I would like to focus on is this importance of digitization of registration processes. And I take up your comment about this two-track approach, where we have not so well-developed infrastructure. We find a way to increase the performance of our paper-based system, as you just described. But in fact, where there is infrastructure, the system is becoming digitized. And in essence, as you mentioned earlier, there is yet again a very important innovation we, I think, could dwell upon, and that is opening the online window to the population or citizens to communicate with civil registration authorities and to some extent complete some of the registration tasks. So maybe just to provoke further thinking and discussions, if I'm a citizen of Ghana and if I have a chance to approach this online platform, how much information I can share and what sort of service I could still get from a registration authority.
Yeah, hello.
Yes,
now,
please go ahead.
Yeah, we are treading cautiously, and we are making progress so that we would rather err on the side of caution. Now, what we have done is we have trained registration staff, we have trained registration volunteers who will start the entire process filling a questionnaire. Now, in the rural areas or the remote areas, once the questionnaire is picked and the certification is done, they now have to fill the information via their tablets or their laptop computers. So when they get to an area where there's connectivity, they are able to now upload the information they collected into the central service. We have not opened a portal for people to do direct applications online. What they can do online for application will be applying for certified copies of an existing registration. But for first-time registrations, they will still have to fill the questionnaire, and then the rest remains on the staff to forward the information from the committee to the central database in Accra. So we are doing that with some level of circumspection. Now, when our databases or our infrastructure is fully developed, that is where we are now going to add the web portal, where people can now go online, fill for the applications. Applications are approved online, and then printing will be done at the district level, so they can pick their certificates from that point. But we are yet to reach that bridge.
Thank you very much. This is a very interesting point. And yet again, I have to say that there is a striking similarity. Just a few days ago, we had an experience of another African country that is working on the implementation, actually rolled out the process where scanned documents can be submitted online, process in the back office, and then if papers are all right, certificate registration can be done at the district and a certificate completed. Yet again, for our audience today, this is just yet another intervention from my side to highlight this very important trend and this trend sort of points out to the need to further unpack this possibility and see how we can all best leverage the opportunity in the future. As I was saying earlier, we have quite a distinguished group of participants today in this meeting. Our colleague Innocent would presumably want to share a few thoughts on the continuity plan, and I would kindly ask if he would be available to request to speak to further clarify on Hughes on the situation, but this is just a slight shift of attention, and that is that functioning of the registration centers as a result of COVID-19. I think there is a great interest from the audience, and that is what I see from questions received so far. How does the process legally, institutionally works, maybe step by step in Ghana after the lockdown announced and certain services are placed under the specific lockdown measures to ensure that there are special permissions provided for the functioning of civil registration offices or to have additional staff. I know you've mentioned this quite a bit in your beginning of your intervention, but yet again, maybe we could just go briefly into what is probably very Ghana-specific set of administrative decisions that need to take place before all these capacities can be put in place to ensure continuity.
Yeah, thank you so much. In the case of a lockdown, that's what we did. We applied through the Minister for Local Government to the Ministry of Interior and obtained special permits for all registration, critical registration staff, so they could move to and fro office to administer registration services. So we didn't shut down the registry, and we won't shut down any lockdown. We'll consider the registration assistants as frontline workers, just like the health service is doing. So they have exemptions to go to office and work. We also ensured that in areas where we couldn't obtain permits for the critical staff, they had to leave their contact on the office premises. So if there was any emergency, we reached them by phone and they could go to office and also offer the service. But in all that, what we did was to make sure that periodically we supply them with the PPEs. So every staff has enough supply of PPEs, because you could be called upon at any time to go perform your duties. So we have kept the registration machinery alive, even when there's a lockdown, and we will intend to pursue that same line of action in case of another lockdown.
Thank you very much. I believe we sort of covered that very well, and in the upcoming brief that Center for Excellence on CRVS Systems and UNECA are producing jointly, some of these issues will be elaborated in greater level of detail. So we will make sure that this information, this brief, will be posted visibly so that you can gain access to this information in a relatively short period of time at greater level of detail. Coming back to the question, to the feedback from our participants, I see that we have comment from colleague Sabata mentioning the importance of increasing that ratio and the use of different strategies for increasing demand for that registration. As you pointed earlier, there are several strategies that are in place in Ghana. In a way, as Sabata mentioned, she commented that if insurance companies that are providing financial coverage for the burial are involved in the process of burial of deceased, in that case, they usually do request a death certificate because before they can discharge their payments, and she acknowledges this as a way of increasing demand for that registration. Using this as a pretext, just a brief question: whether similar strategies are being used in Ghana, or whether you are thinking of other ways how to raise awareness of the importance of death registration, or to provide concrete incentives that would generate demand for such services.
Thank you. I mentioned earlier that in Ghana, a similar regime operates. Before you could access welfare benefits or insurance benefits, you had to produce a death certificate. And that is one way of getting people to respond to death registration. The next level that we are introducing in Ghana is that we are asking all burial grounds to be registered and controlled, so that sextons who are in charge of those burial grounds, even before burial takes place, would inspect a burial permit. And you could only obtain a burial permit after you have registered a death. So, whereas we have this insurance thing in place, we have other agencies demanding death certificates as proof of financial and legal requests. We are also making sure that we enforce the law, which says that every dead person should be registered before burial takes place. And we think control of the cemeteries is a sure way of making this a reality. So we are trying to get the district assemblies to help us to do that. Once there's somebody to demand a burial permit, we are sure registration would have been effected, and this would increase death registration coverage.
Great. Thank you very much. If there are any other ideas about strategies or incentives to generate demand for that registration that colleagues could contribute with from around from the participants, we would sincerely appreciate to hear from that. On the demand side, you did mention that you have a quite extensive cooperation with religious authorities and other local community authorities. I know that these are quite extensive discussions, and that they also include deciding on the date when a registration event could take place. I find that very interesting. I remember clearly the phrase taboo dates. Maybe you could deliberate on that type of discussion. What sort of considerations are taken into account when deciding, okay, on this date, this is the best opportunity for us to come to this local community. I know, for instance, about the use of vans, specifically procured vans that are turned into a registration stations that travel with registration authorities from one area to another. I think this is a very, very useful experience from Ghana that other participants would be happy to hear about.
That's true. Thank you. We have not done all this leaving out the community leaders. So before we went into any community to effect registration, we worked closely with the leadership, the chiefs, the traditional rulers, the religious organizations. We go in with them, and then they mobilize the people for us before we go to do the registrations. And their involvement has been very, very helpful, because you couldn't go into a community without their support. And once we have done that, now the chiefs and the local leaders and the assemblymen own the process. They lead it, and then they make sure they follow up and put in place all the logistics for us. So involvement of the local traditional leaders, the chiefs, has been very helpful, and I think other countries could also leverage on that.
Wonderful. Thank you very much. I want to say that before we organized this webinar, we asked the participants to kindly feed us the questions that we could share with our distinguished colleagues from Ghana to probe, to ask for their feedback. So we are in a way closely exhausting those questions from previous sessions, which then leaves us very little time for further interventions and questions from the colleagues who are attending this webinar. So I'm using this opportunity to incite more questions, more feedback, including speaking live and intervening in the interventions. So this is a sort of a call for interventions and feedback. Otherwise, we will go from maybe one or two more questions before we will be winding up these discussions. So with that, I wanted to ask questions sort of that I kept for as we approach towards the end of our session. In many respects, this health crisis has enabled Ghana authorities to use business continuity plan to introduce many innovations and to increase the performance of registration in many areas. To what extent this is going to be a permanent system for Ghana in the future, or I should rather say, to what extent you expect that this will be a permanent feature of the law or internal regulations for the further future functioning of Ghana's civil registration process?
Yeah, let me admit that the government of Ghana is really interested in civil registration as a basis for generating statistical data about the population, and also as a basis for initiating all identity programs that are running to which the government is committed to. For instance, the government now realizes or admits that birth certificates are critical for the development of national identity systems, that data that is needed for planning purposes at the district and regional levels are also an outcome of civil registration. Ghana is also pursuing with a lot of diligence the SDG goals. And if you recall, SDG 16.3 is talking about using building identity systems with free birth registration as a cornerstone. And since the government has bought into all these programs, it is now trying to ensure that we got sole registration and identity systems set right, with birth registration as a cornerstone of all these development efforts. Ghana is also seriously in the agenda of decentralizing governance to the local level. And to this extent, governance will bother about planning. Planning will depend on quality data and measurements about the population. And the government sees that civil registration will provide that data that will foster good planning and good decision making at every level of governance, from the community to the district, to the regional, to the national. And for this reason, government is investing heavily in the birth and death registration. What we need to do now is to ensure that we pull all stakeholders along. Birth, death, marriage, we should get all these working together to ensure that we have composite civil registration data that will facilitate planning for good governance of this country. And this is where the government's interest is. So we are ensuring that we are getting a lot of support from central government and from the local administrations also to further civil registration.
Thank you very much. This already sounds like a very future thinking of the for the system in Ghana, and a message that a number of lessons learned from implementing a business continuity plan for the time being in Ghana, how it will inform future reformed system for civil registration in Ghana. I also think that it is quite important takeaway from this discussion that from these additional efforts and great effort to introduce new facilitated approaches to registration of birth, and that has a greater interest from the government to understand to what extent civil registration, CRVS authorities can actually do for the society, and what sort of valuable information they do provide. Before I turn over to Annette, because for the time being, I'm not seeing any offer for further question. My question would be, to what extent there would be like three questions. One is, to what extent do you see the possibility to share statistical data with the statistics office, a national statistics office now? To what extent that data would be useful for them? And what sort of recommendations would you forward to other colleagues across African continent, what they can learn from your experience that they could possibly implement for their own business continuity plans in the future, but also in general to improve their national civil registration and vital statistics system.
Yeah, thank you so much. For Ghana, we have very close working relationship with the Ghana Statistical Service. In fact, our law enjoins us to make regular reports of all deaths and deaths that have occurred in the country to the Ghana Statistical Service. The Statistical Service will now do the analysis of the data that we generate, and then they publish civil registration data on behalf of the country. Therefore, right from the onset of data generation, we work with the Ghana Statistical Service. They help us to make the projections. They help us to draw the maps. They help us to actually set up targets and estimates for every area. And so once we have done that, the birth and death registry now goes out there to try and get the information. And then we pass it to the Ghana Statistical Service. Then they analyze and publish. So there's this good working relationship between them. We have enjoyed a lot of technical cooperation and guidance also from the statistical service. When we have had to do community population registration programs, it is with the involvement of the Ghana Statistical Service. They have offered training, they have offered logistical support, they have offered guidance, and so there's a very good working relationship between the Civil Registration Agency and the Ghana Statistical Service as a central or lead agency that's coordinating all data that's generated. We would want to recommend to sister African countries that there's a need for us to ensure that we engender quality data, so registration data, at the basic level to facilitate what we will call effective decision making. Creating demand for registration documents will definitely also lead to increase in coverage. That is why in Ghana, we are trying to interface civil registration with other service providers. So there's a link between the Ghana Births and Deaths Registry, the National Identification Authority, the Ghana Health Service, National Health Insurance Scheme, Social Security Schemes, all who will make use of civil registration data will foster demand at very early levels to ensure that registration is increased. So it is collaboration and closely working together that will make our efforts gel. So we recommend that civil registration systems should not stand alone. They should be linked with essential service provision at very early ages in life. And we think that will help us increase civil registration data and realize the importance of civil registration in Africa.
Thank you very much. I think all of these recommendations are extremely important, and I'm sure that all the colleagues who are participating are listening very carefully and will take them on board. As I said earlier, my plan was to slowly go and close these discussions, but nevertheless, every new intervention opens up apparently some very new learning and that is important for all of us, and I would like to highlight, and something that you mentioned in the context of cooperation with the National Statistics Office, and that is that traditionally one would expect that Civil Registration Authority feeds the information, provides raw information to National Statistics Office to produce vital statistics. Yet you mentioned something very important that I think we should all think about and further explore to see further possibilities of such good practice from other countries. And that is that National Statistics Office provides feedback information to the civil registration authorities to help better plan and assess where civil registration services are needed across the country. I think this is very important. On that note, maybe just last question from my side, and that is whether do you see any similar cooperation with health authorities? In essence, we see that health authorities are providing services to civil registration through notifications and help in the registration process. Is there any return loop, the possibility for civil registration authorities to provide some information back to health authorities that they see extremely relevant for their own functioning and that they can get only from civil registration?
Sorry, I didn't mention this. I've taken for granted that we have always assumed that the civil registration system is always linked with the health service provision. In Ghana, there's a lot of collaboration between the civil registration office and the Ghana Health Service. We have used health service structures to gather information on health and births. We have used health service structures to also get information on deaths. So there's a lot of information flow between these two agencies. And what we have done now is to try to even interface the Ghana Health Service systems to the civil registration systems at several levels. So whatever information filters into the health service system also hits the civil registration system. That is how we've been able to increase birth registration coverage. We continue to enjoy a lot of working partnership with the health service. Without them, it would have been very difficult and challenging for us. So we also advocate that health service, the civil registration system, and the Ghana the statistical service systems should be closely linked or interfaced. We think this will close the loop and it will help all of us achieve a common end. In Ghana, we have occasionally used health workers as most of the registration volunteers. We have used some of them to service the population where we don't have registration staff. We get the health service staff to pick information and relay to the civil registry. So we enjoy a lot of good working relationship with them, and we compare notes a lot. The verbal autopsy we did together with them, the community population registration we did together with them, and so many interventions we have done with the health services.
Thank you very much. We are, I believe, all very happy to hear that there is a recognition on the institutional level to what extent these two services are intertwined and that these two services reinforce each other's work for the benefit of both government sectors. Thank you very much for your kind feedback and all of these excellent cases of good practice. I believe that through this conversation, we have had a very good insight into what's going on in Ghana, and that this discussion has uncovered a lot of good practices and initiatives that will make a lot of national authorities as well as experts participating in these discussions to think in the future. And I'm sure that on many of these issues that you already mentioned, there is going to be some continued learning generated so that we can further unpack those practices and expose them to greater expert and practitioner audiences across Africa as well as globally. With that, I'm closing from my side and I'm turning over to my colleague Annette for a few last remarks. Annette, over to you.
Thank you very much, Soren. So thank you, Mr. Kingsley and Mr. Emmanuel. Thank you so much for sharing. It's been a very rich discussion, and we have all learned a lot. So it's a heartfelt thank you from me to participate in not just this expert dialogue, but of course also for allowing your insight into documenting your good practices during this crisis. So I take a few things away. I'm very happy for you to have shared your contingency plan, the actually content, but also your strategy to actually formulate it by collaborating with your close partners and how you manage to get political will behind your plan. I also think it's very interesting how you saw an opportunity in raised political interest in civil registration to now implement your various strategy. And I think that's something that is important. Sometimes there's increased political attention and awareness around a certain topic, and you definitely saw that as an opportunity, and all your lined up project you managed to actually push forward and implement. And I'm quite sure that very soon we're going to see the actually results and benefits from that. I also would like to stress, as you have done, and that's one of my takeaways, again, how your collaboration with so many different authorities have strengthened your plan. You're maintaining traditional leaders, religious leaders, you cooperating with the funeral service, with health, with statistics. So it's been very interesting, and I really compliment you for all your great work. I also, of course, would like to thank all the participants that has been with us today. I hope you have enjoyed it, and I want to remind you that we're having our last expert dialogue tomorrow, where it's going to be Namibia's turn to speak about how the National Population Register, which is an integrated civil registration and ID systems, have managed to form the pillar or basis for their emergency grant very early in this health crisis. So please join us again tomorrow and hear about the Namibian experience. And then please also go to UNECA's webpage, the Center of Excellence page, the Center of Excellence webpage, where you can find all the different technical papers that we have developed about different good practice cases. There's also a good practice now from Uganda, Mozambique. There's coming one from Rwanda and Burkina Faso. So please, go in and follow our page, where you would see a new material being released all the time. And then also thank you very much to Karen, thank you for Soren, thank you for Holly, who's been behind the scene and being part of organize this dialogue. So I will end here and wish you all a good day or evening, and hopefully we'll see each other again tomorrow. Goodbye. Holly? Holly?
Yes.
Is all the participants off?
There are 3 on screen and 9 off screen.
Okay. Do you want to send us a link, or do you?
Yeah, sure. I will send a Google Teams link now.
Okay, so Soren, Karen, Hosea, let's just meet on somewhere else. Thank you.
I will be joining Teams in 10 minutes. Okay.